Welcome to this live Q&A hosted by the Cleft Lip and Palate Association on the subject of the treatment pathway. In this Q&A, we'll be focusing on the treatment pathway when returning to treatment. This event is open to everybody in the CLAPA community. Before we go any further, I just want to say a big thank you to our funders, the National Lottery Community Fund and Smile Train, for enabling us this event to happen this evening. My name's Kate. I am a parent of a child born with a cleft. My Harry is 3 years old and I'm based in the West Midlands, and I've been volunteering for about 2.5 years. Today I'm joined by Despina.
Hi everyone, Despina. I was born with bilateral cleft lip and I have been volunteering with CLAPA for almost 6 years now, and I'm based in London.
Lovely, thank you, Despina. We'd also like to welcome Andrew, Karen, Nick and Ambika, who will be answering your questions. If we'll start with Andrew, would you like to introduce yourself, please?
Yeah, good evening, everybody. And my name is Andrew. I've been a volunteer for CLAPA for about 14 years, and quite a number of those years I've been a peer supporter, and I'm also a member of the adult focus group.
Lovely, thank you. And Karen?
Hi there, I'm Karen. I'm a clinical psychologist and I work with the Newcastle team, and I've been with them about 10 years now, I think.
Thank you. And Nick?
Hi everyone, I'm Nick. I'm a consultant cleft orthodontist based in the southwest in Bristol. I've been doing that for 3 years in total.
Thanks so much. And last but not
So my name is Ambika. I'm a cleft surgeon. I did my cleft training in Birmingham, where I'm working as a craniofacial fellow, but I'm very closely allied to the West Midlands team.
Thanks so much, and thank you all for joining us today.
Thank you as well to everyone who has submitted a question in advance. If you have a question while watching, please do pop it in the comments and someone from CLAPA will either respond directly or pass the question to us. We have had a lot of interest on this topic, so we will do our very best to answer everyone's questions. However, if there are any questions that we don't get around to answering, then we will try and get back to you in the chat feature after the event.
Right, we better get on with the questions then. So first question is from me. How do I return to treatment? I've asked my GP, but they don't seem to have any information about this.
So I think there's something about telling your GP that you were born with a cleft, trying to explain a bit about that. And I guess explaining to them that you'd like to be referred back to a cleft team, and that could be to discuss some concerns that you had, or perhaps to explore treatment options. I guess they might want to know a little bit more about the type of cleft that you have, or the impact that a cleft may be having. Perhaps about the type of treatment that you're seeking, or the sorts of concerns that you have. But CLAPA have got information on their website about all of the cleft teams across the country. So I guess if you're having difficulty with the GP, then perhaps look at that information, have a look at your nearest cleft team. Perhaps go armed with that to your GP. If you've seen a GP and that hasn't worked out, perhaps try again, or you could seek that through a dentist as well. I think although things differ across the country, the majority of cleft teams would prefer that referrals came in via the GP, or would ask for that. And so I guess that's the starting point. There is some extra information on the CLAPA website about which teams, or some of them would accept self-referrals, so you could have a look there as well. And I guess if you are still having problems, then I would encourage you to get in touch with the cleft team based closest to you, see if they can help you with the process at all and support you with that.
Karen, if I could just add one little thing there. As you pointed out, the website is very, very good on this stuff. And you will see a letter that's been prepared on behalf of anybody that's having problems. But very often the GP says, oh, I don't know anything about this. So there is a letter already there to be used, and that can be given to the GP and that should get the ball rolling.
Thank you.
Thank you so much. Let's go to the second question, which is about cleft lip scars and visibility. Can a cleft lip scar fade as we get older? I feel mine has gotten more visible over the years, and it makes me feel a little insecure at times. Are there any treatments available for this?
So I'll start by answering that question, if I may. Thank you for the question. The first thing that I would say is, yes, a cleft lip scar can fade as we get older, but scarring is one of those things that is highly individualized, and it's really difficult to predict. And the way a scar changes affects people differently. I would definitely say, if it's bothering you, to reach out to your cleft service and the multidisciplinary team within it. It's sometimes really tempting to take maybe different avenues to treat scars. And the risk of that is that perhaps you access a practitioner who doesn't have the ability to offer the full range of treatments and may not have knowledge about cleft. And that's actually something that I'm working very closely with CLAPA about right now. There are lots of reasons why a scar might change. We've already talked about the individualized nature, that's genetics, but it can be due to natural aging changes. It can be due to sun exposure and pigmentation, and things like redness and vascularity and textural changes can also contribute to how you perceive a scar. What can be done about it? Lots of things, actually, from really non-invasive things all the way up to surgery. So if we just walk through these, some of these are preventive, such as using an SPF 30 to 50 daily is important. You can use silicone gels and patches. We often use them sometimes nearer the time that we've treated somebody. It's also possible to use other topical agents, but again, I wouldn't recommend doing this unless you went through your cleft MDT. And there are other things as well, such as using makeup and camouflage. So all of those things are relatively non-invasive. The best options are often a select mix of options. Again, it's your cleft MDT that are in an excellent position to offer this. So, for example, you can have a variety of non-surgical options which can address different concerns. So there are various laser treatments that you can use if you've got a pigmentation concern. If there is a raised or thickened scar, there can be steroid injections that are used. Microneedling is also used. And then as we get more invasive, we can look at things such as a scar revision, which can be explained. And as I mentioned, a lot of this is combinatorial treatment. So it's different things together, but under one cleft team that is able to specifically address your needs. And when you visit that cleft team, they will, of course, assess you, they will listen to you and identify exactly what your concerns are in conjunction with other members, such as our psychologist. And we'll also be able to do serial records of the area of concern to look at it a little bit more objectively and take it from there.
I guess just to add to that, so it's great to hear about all of the options and all of the treatments. I guess some of the things that can be offered from a psychological point of view might be that, so there are psychologists attached to all cleft teams across the country, and we would have a role for people that may be thinking about different treatment options, perhaps in providing them a space just to think about the pros and cons of different surgeries. It's not our role to talk people into or out of different options, or to decide whether or not they can have those, but I guess to provide that space to think about what the concerns are, like you said, Ambika, being really clear about what it is that they're concerned about and how treatments can match onto those things. And I guess the other thing is also thinking about perhaps insecurities about appearance, or perhaps the emotional impact of having a scar or a cleft. As psychologists, we can certainly provide space for the person to sort of unpack that really, and to think about from a psychological point of view, how are they coping with those things. And I guess that can be done alongside of the treatment or separate to, depending upon, like you said, the personal circumstances, really.
Thank you both. We have had a question live, so I'm just going to ask that one before we carry on. And I think Ambika, it's probably best for you to answer, I suppose. But the question is, I'm 37 and haven't had surgery since my bone graft when I was 11. I'm having lip revision next week on the 10th of October and is super excited. Anything I need to buy in advance? I've got paracetamol and ibuprofen, but is there anything else you could suggest?
Not really. Maybe a blender if you haven't got one. I mean, a lip revision, it can be very minor. It can be a near takedown of the original repair, but the recovery really centers on wound care, and you'll definitely get adequate instruction in that. It's about keeping the area nice and clean and dry in the first instance. And different surgeons will use different types of stitches. Most people, I think, are using stitches that dissolve and don't need to be taken out. Some people use glue. But on the whole, if you just keep the area really hygienic, there's no reason why you won't get an excellent result. I can't really think of anything that I would go out and buy. I probably would make sure, though, that you had a good sunscreen, since we've been talking about it. And apart from that, no, I think that's absolutely fine. Sometimes the lips can get a little bit dry, and after about a week, you can use an emollient on your lips. But I wouldn't use it before. No, and I wish you all the best.
Yeah, I guess just to add to that, it may be helpful. It sounds like you've been really excited about having this surgery, and that's fantastic and a great position to be in. But I guess if you're thinking about surgery, then just thinking that it may raise some questions from people that maybe have never asked about your scar or your cleft before. It can, I guess, raise that as a conversation topic when you're very sort of not used to having that. And so I guess we encourage people just to have a little bit of a think about that, and to think about what they might be happy sharing with people. And that can be both people that you know really well, and also sort of more like strangers, or if somebody were to ask you about those things, and you being in control of that, you being able to decide how much you share and what you're comfortable with. But basically just having a little think about that in advance can be helpful for people.
Thank you. Thank you both. The next question is, I have a great dentist, but I'm not sure about the information he has given me regarding a dental implant. I don't think he understands my cleft. Is there someone I could speak to about this who would be more knowledgeable about cleft?
I think I'll take the floor with that one. So yeah, there's not every dentist. First of all, not every dentist does dental implants. But as part of the Cleft team, we have specialist dentists known as restorative dentists. And restorative dentists place implants, they do crown work, veneer work, bridges. And so if you're concerned and you want further information about dental implants and you feel that it's something that you're seeking, then by all means, I think it's important to contact the Cleft team and gain access, in the hope to having a consultation with the restorative department in your local area, who could possibly give you that guidance and advice. By all means, you don't need to necessarily get that treatment within a cleft setting. If the restorative team feel that that's not necessarily an issue regarding your cleft, then you can always seek that out outside of the hospital, if particularly in terms of waiting times, if that's an issue for you. But if it's not an issue for you and you're happy to wait, then by all means, go to your local hospital, or your local cleft team, I should say. And I think you'll get the best advice at that juncture.
100% echo what Nick said, actually. One of the important things to consider, and it will be a theme I keep coming back to, is that a cleft team is made up of so many different professionals for a reason. And your restorative dentist is one of the members of that team. But sometimes when we're looking at implants, there's some surgery that might need to be done around it. For example, we have to look at the height and thickness of your bone. And if ever you might need additional peri-implant surgery, then you would be within the correct team already to make sure that that was done in keeping with your restorative dentist's plan, and that communication between clinicians in the same team that are fully understanding your particular presentation is really, really important.
Thank you both. We can move to the next question, which is, I'm considering returning to treatment and have had a referral submitted to my local Cleft team. I'm not sure if I want further surgery or not, and I'm worried I will end up in a situation I'm not comfortable with. Who can I talk to about my concerns?
Could I kick that one off? Because I was born in the 50s when there was no cleft teams around. They've actually only been around less than 30 years. I think I'd be right in thinking that or saying that. But about 6 years ago, my high street dentist pointed out to me that I would be wise to consider having implants in my 2 front teeth, because the bone will deteriorate over time potentially. He referred me to his go-to specialist, implant specialist, who I went to see. And as a result of that, I just said, you know, out of interest, how many patients have you got or had that has got a cleft lip and palate? And he said, well, I've been specializing in this area for 20 years, and you are the first patient that I've seen with a cleft lip. I was absolutely astounded. To cut a long story short, and no disrespect to that specialist, when I realized I could seek a consultation with the Cleft team, the restorative dentist I saw at the Royal London Hospital, and did a fantastic job. And I felt at ease as well, because I knew that he had a lot of experience in that field. And the aftercare was also particularly good. And 6 years on, I'm still having 6 monthly checkups. And that encompasses the really important aspects of making sure that you clean your teeth properly. And I've come in and out of that, of getting maximum points to getting not so good points. But I realise now that it is imperative to preserve gums as well, is to look after them. But that was my experience. But I don't know if you want to add to that, Karen.
So that's really interesting and great to hear, Andrew. I guess I was thinking about, if somebody is wanting to or is interested in being seen by the Cleft team, that doesn't have to be because they are coming with a clear view of what they want to be changed. It could be, I guess, a bit like you, Andrew, it could be somebody that hasn't been seen for a long time and might just be interested to hear about where treatment is up to and to have a think about whether there is something available for them. So I think coming with just some ideas or just as a space to think is absolutely fine too. I guess I would really hope that that nobody were to feel pressure or be pressured into treatment of any type. And I guess it's really important that people know that they would often within a clinic see a number of professionals. So they might see a surgeon, but they may also see other members of the team, like psychology or a speech therapist, dental colleagues as well, and sort of have a number of conversations about different aspects that can be related to cleft. And I guess it's about them being clear about what, or trying to be clear with the people that ask them those things about what actually they are concerned about and where they feel fine or feel that things are good. I guess I would encourage people to sort of, we know that it can be a lot of pressure coming to a health appointment like that, and especially if there are more than one or a number of professionals to see, people can feel really anxious about that, and we absolutely appreciate that as professionals. And I guess I would encourage people to see us as humans as well, and if they're to tell us, I feel really anxious about this, or I'm worried about that, or the main thing I want to get out of today's appointment is this, then I think that helps us as a team and all the professionals to work together and to sort of try to help people with that. Certainly as psychologists, we would tend to talk with people about what's brought you here today, and what is it that you're hoping to get out of the appointment, and what sort of concerns do you have, and to try to, I guess, help people to feel heard and to be able to express themselves. And if there are people that perhaps struggle because of anxiety or other issues, to help them to get those points across to the team. So that's a role that we can play there. And I know that some teams actually ask people to see a psychologist ahead of coming in to see the whole team as well. And that's a way of gathering some of that information and sort of having a longer chat, maybe even using some questionnaires and those sorts of things to pull that information together. But I guess, yeah, I would never want anybody to think that they needed to come in either knowing what they wanted or having to say yes on the day. And I would encourage people to sort of take that time. And if they can't tell the professional, perhaps feeling under pressure, you know, when you're right there in front of a surgeon or in front of a dentist, telling any member of the team, actually, I need a bit more time to think, or I'm not quite sure about that. Those sorts of things. I'm sure there are lots of other ideas that people have around that.
Thank you. Thank you both. The next question is, it has been many years since my last operation. I'm still very unhappy with my appearance, and I would like to see if there's anything else that could be done for me to help me feel happier in my appearance. What further surgical options may be available? Ambika, you're on mute.
I am sorry. I said with the help of Karen, I can try to answer this question, and anyone else as well. So I think the first thing to say is please visit your Cleft team. You say that you're very unhappy with your appearance, and it's been a while since your last operation. And the first thing that we'd like to do is to find out what's obviously making you unhappy, and a little bit about your past history, your Cleft history and medical history. And that might be the entire conversation for the first consultation, to tease out exactly what that is. And no doubt Karen and other psychologists with their expertise are able to bring that out more fully, because once we get a really good contextual understanding of what might be making somebody unhappy, then we can look at all variety of treatment options. And some of the options are no treatment, and some of the options might be surgery, but in between those is a whole spectrum of options involving pretty much every member of that team. So until we get to understand exactly what it is that's bothering you and your personal circumstances around it, then we're not able to help. Karen, I don't know what you want to say from a psychological perspective, but I'm sure you've got a lot to say.
I mean, that's really kind, Ambika, and I'm not sure that I've got lots and lots to add, but I think it is something about, you know, helping people to unpick which aspects of their appearance or elsewise they are unhappy with, which bits they're actually happy with or okay with, which bits it's like almost like, actually, I'd like to just leave that alone because I'm okay with this. And as psychologists, I guess we can do that within clinic and help people there. But sometimes we then offer appointments separately and outside of clinic where we've got longer to do that, just to take the pressure off. There may have been a big clinic appointment, but actually let's meet in between. There might be something else coming up, and let's just have time to think about this. And I guess trying to get a better idea of that will help the surgeons then have a better idea of what surgical options are appropriate, what sort of, you know, you'll have lots of ideas, Ambika, about the types of surgeries you can offer, but which things are appropriate to that person and those specific circumstances. And I think that there's something about psychology helping people to both explore those things and potentially communicate those with the team as well. So sometimes a good summary letter back to the patient, but also, you know, if we've got consent to be copying the surgeon in or whatever, then that can really help at the next appointment. And I guess the other aspect of things, like you've said, it might be that there are no surgical options that are either appropriate or wanting to be looked at, but perhaps thinking about whether some psychological support around the dissatisfaction or the self-consciousness, or perhaps there's something about dealing with the impact of difficult experience that have happened or have, you know, are happening in the person's life, and the emotional impact of that, and sort of having a cleft. So there's certainly things that as psychologists we are involved in and sort of working with people on with all of the time. So that you know, psychology is available in each team, and those things are available alongside other treatments or on their own.
And many times the treatment that we may consider is actually not surgical. So to give an example, we may have a patient, for example, who points to their teeth and the projection of their lip. And they don't like, for example, again, how crooked their teeth are. Well, that would need the expertise of an orthodontist more than the expertise of a surgeon. Sometimes we're all working together and we are staging a more complex treatment plan, but one that we've discussed at length over several appointments. An example of that would be, for example, jaw surgery, where the projection again is affected, but in a different way. And that's working in close collaboration with the orthodontist, sometimes a restorative dentist, and of course the surgeon. So everything is tailored to what is best for the patient after we understand exactly why they're unhappy.
Thank you both. Very interesting chat. We can move to the next question, which is, I'm struggling to get a referral to my local NHS Cleft team through my GP or dentist. What can I do?
I mean, I think that this is quite like the first question, and I think that essentially maybe trying a different GP or dentist if you've got, you know, that luxury, or another GP within the practice. Again, taking the information from the CLAPA website, your local team, and sort of thrusting that in front of them and saying, this is who I want referring to. Perhaps being prepared to be asked some questions about your cleft and what it is that you've had in the past, and perhaps what you're wanting to explore now. And failing all of that, I would encourage you to get in touch with your local cleft team and see whether they can support you further with that process of getting in touch and getting the right information to for them to take you on as a referral.
Oh, Andrew, I think you're on mute.
Sorry. Yeah, I would just add again to say that there is a pre-done letter that can be you get that off the website or the CLAPA website, and you can hand that to your dentist or to the GP and say, you know, here it is.
Thank you. So the next question is, what dental orthodontic treatment may be available to me as an adult through the Cleft team / orthodontist?
Yeah, so typically in Cleft teams, certainly in the Southwest, it's going to be train track braces. Train track braces are the traditional type of brace that we tend to offer, and they're usually metal. It all depends on And of course, everyone's bite's different, everyone's teeth are different, whether you need a top and bottom brace. But usually, vast 95% of the time, you're going to need top and bottom braces, because we're not only trying to straighten your teeth and make them look really nice, but we're also looking at your bite. So I always explain to people, your bite's like a jigsaw puzzle. You want the teeth to interdigitate really nicely and sock in. And you're not going to be able to do that if you just have braces on your top teeth, for example. So there are certain cases you can do that, but on the whole, you're going to be doing train trap braces made out of metal. Some people do come to me and ask me about different types of braces. The most common type of brace is the aligner, or people call it Invisalign, which is the most popular brand. But that is not going to be available, as far as I'm aware, in any Cleft team in the country, and certainly not available on the NHS. So if that was something that you were keen on, and you felt that an aligner or something like an Invisalign type of brace is something that you're really seeking, you're going to have to seek that out privately. And again, orthodontists who don't deal with Cleft patients may feel a little bit on edge or a little bit uneasy of treating patients with Clefts. And that kind of then you go back within the Cleft team and you end up with train trap braces. But it's not impossible. If you find a Cleft orthodontist who works in practice, it's possible. But yeah, hope that helps.
Thank you so much. We can move to the next question, which is about in which situations should I see my general dental practitioner? In which situations should I visit my Cleft team specialist dentist?
So again, within the dental setting, we like to collaborate with, we encourage all of our patients to have a general dentist on outside of the hospital. So we want to collaborate with the general dentist. So what we typically find is patients who are registered with a general dentist that need fillings, or they need cleanups, or even need extractions, we will always at the very first instant write a letter to the dentist outside of the hospital to help carry that work out. So if you do have a dentist, great. And as we all know, in today's climate, it is really hard for a lot of people to get registered with an NHS dentist. So I'm finding, particularly in the Southwest, there are many people that are not registered. In those type of cases, the Cleft team can help with that. Certainly from my experience, to find any dental practitioners that are accepting patients. But the patients that we try and keep in-house within the Cleft team are those who are really, really anxious about extractions, who may require things like sedation, and therefore we can refer to our pediatric colleagues. Patients who require, for example, fillings, again, they're quite nervous and require sedation, again, we'll go to our pediatric team. And anything along the lines of requiring surgery or exposures of teeth like canines, they will stay within the Cleft team. But in general, on the whole, we will always try and collaborate with, bread and butter or routine general dentistry to your dentist.
Thank you. So what support is available if I'm having difficulties with my hearing? I'm feeling self-conscious about wearing hearing aids.
Again, I think that one can, speaking from my own experience, I have the canals in my ears are quite narrow, and that has caused me to have quite a lot of blockage. And under the ENT unit, I go every 6 months to have microsuction and to remove the excess wax that's built up there. So the answer is yeah, that it's another situation where through the Cleft team you can be treated for that.
Yeah. Yeah, that's great to hear, Andrew. And I guess if somebody were to be having hearing problems but weren't already known to sort of ENT or audiology, they could seek that referral through the Cleft team, if they're open to them, or through the GP. I guess if it's through the GP, then or through another referrer, letting them know that you were born with a cleft, because that can have an impact on sort of the types of treatment options, etc., available, and I guess would give the team a bit more information, to help them. But an up-to-date assessment of hearing, I guess, would at least give the person accurate information about any hearing difficulties, what the session was, and what might be able to be done about this. If a hearing aid is suggested, then it would be a good idea to speak with the team and get an idea of the type of hearing aid and what that, asking to have a look at that, what that would look like. I think things have come on an awful lot over years, and even in recent years, and hearing aids, I guess, are very different now than, how they might have been 10, 20 years ago. So people might have a bit of an inaccurate information, in their mind about what that might look like, and lots of them are so small that, almost imperceptible, really. But I guess if the person was still feeling self-conscious about the idea of getting hearing aids or any other aspects of visible difference, then that is certainly something that psychology could support a person to explore and address. So absolutely get in touch with us, or let the team know that that's something you're struggling with, and we would be happy to meet with you to talk that through.
Thank you so much. We have an extra question from the chat, and it's about what happens if I have no back teeth. Can I still have braces?
It's really difficult to answer that question, if I'm being honest with you. It comes down, I'll go back to my previous answer, the bite's like a jigsaw puzzle. So you can't look at the teeth in isolation. You've got to look at the jaws. You've got to look at how they're fitting together. But with the information that you've given me, look, it can be difficult to have braces without back teeth, but it's so hard to answer that question. I would really need to have a look at pictures, and anything's possible, but it's difficult to know. Please go to your orthodontist for that information.
Thank you. We have another live question. Hi, at what age would you generally put a train track brace on? Thank you.
So in general, we want to wait for all the adult teeth to come through. So it's around about 12, 13 where, that can all kind of take place. It's unlikely it happens early, but it can happen. Everyone's different. But around about 12, 13 years old, that's when, we start seriously thinking about braces and whether we can start fitting them on, and having a consultation with our patients about what treatment, what the outlook's going to look like, if we need any extractions, if we need to bring in any other specialist colleagues involved. But that's a ballpark figure. And again, certainly in my experience, I do have some patients who have braces a little bit early. If they need something called an alveolar bone graft, we may need to do some work around about 7 or 8 years old. So that can be for that reason. But that's a short-term type of brace. That's not comprehensive treatment. But the majority of my patients are around the ages of 12 to 18. Anything older than that are patients who may need surgery, or they're coming back for retreatment for braces. So it's a wider age range, but in general, 12, 13 is a safe bet answer.
Thank you so much. We can move to the next question, which is about a fistula repair surgery. How much time off work will I need, and how long will it take me to recover?
So this is a bit of a tricky question, and that's not a cop-out answer, but it depends on two main things, and that's on the nature of surgery, and also what kind of job you might have. It depends on the nature of surgery, because some fistulae are, relatively speaking, more straightforward to repair than others, and that is reflected in how invasive and prolonged the surgery might be. So in certain cases, it could be borrowing tissue and folding it over in a certain way to cover a fistula up and to repair it. And in other more extensive, persistent fistulae, it might mean borrowing tissue from, for example, the cheek and keeping it tethered for a little while, and then coming back for a second operation, which is far less invasive but involves untethering. On the whole, though, to answer the question generally, I would suggest a minimum of 2 to 3 weeks off work. And that's because in the beginning, on the first 2-3 days, you'll get a little bit of soreness and swelling, which should be easily controlled with everyday painkillers. And hopefully you'll be on a soft diet. That's usually what we would advise, and you'll be tired naturally. And hopefully you might have someone on hand to help blend all of your food. After a few days, that pain and soreness improves. I would still say that no sucking or straining should happen, no straws in the mouth or anything like that that could jeopardize the repair. And then gradually your skin inside the mouth, which we call a mucosa, will have healed over. So that by the time it's about a week or two, you'll get coverage. But that's not the same thing as saying you've got full healing. That will take many more weeks. I would say a minimum of 4 to 6 weeks. And in the interim, you will gradually be moving from a predominantly liquid diet to one that is a little bit more mushy, to eventually moving on to more solid foods gradually as the healing progresses, all the while keeping meticulous oral hygiene, which is really key. So definitely have a minimum of 2 weeks off. If you can get 3, that's even better. And that's to help with your normal healing processes, but also keeping an eye on things like excellent oral hygiene, definitely no smoking before or during or after the operation, taking any medications as prescribed, painkillers, perhaps some antibiotics, and keeping an eye on your food moving, as I said, from a very liquid diet to progressively solid. And it's not unusual for some surgeons to want to check on you in the first 7 to 14 days. And if you're off work, that will cause less disruption than perhaps if you are on work. And then, of course, there'll be a checkup, usually at around about 6 to 8 weeks. So that would be my recommendation.
Thank you. That's very, very helpful. So moving on to the last question of this evening, is can I return to treatment for psychology?
Absolutely, and we would encourage you to. I guess if you're not known to the Cleft team at that point, you may need to seek referral back to the Cleft team. So you know, the sort of the way that most teams would want that would be through the GP. I guess you can let your GP know that it's more for psychology, and that could be on the referral. Referrals are often screened as they come into teams. It may be then that you're sort of, you know, directed straight for a psychology appointment, rather than going through the team. It may also be that actually you're invited to come to a Cleft team clinic appointment first, and psychology might be there, or may not be present. But I guess that would give you an opportunity to meet each member of the team and to sort of just think about your Cleft as a whole, and think about, are there any other aspects of treatment that you know you would like to discuss or maybe interested in as well. And I guess if you're offered then a psychology appointment, or if you see a psychologist in clinic and you're wanting some work around and things that are going on, they'd probably offer you then a separate psychology appointment. Clinics are really busy for us as clinicians, but also for you as patients. And if you're coming into a team and sort of seeing a number of members of the team, we know that can be, you know, very cumbersome. So I guess giving you a separate psychology appointment gives us time to then be able to sort of sit with you and chat. So the psychology appointments often last sort of somewhere up to an hour, just a little bit less. People sometimes worry that they won't have enough to say, and you know, you don't have to stay the hour, and you know, but the time is there, so we're not having to rush through things. And I guess appointments can be offered face-to-face or by telephone or video, and I guess that is dependent on service availability, but also your preference as a patient. And if you live a long way from the hospital and those sorts of things, I guess doing something by video or telephone can be really helpful. But yeah, absolutely come back to psychology if there are things about your cleft that you're unhappy with, you're struggling, or you're feeling like it's having an impact on emotional well-being.
Thank you.
Well, thank you so much, everyone. That's all we have time for tonight, I'm afraid. If you would like to provide us with any feedback, we will be incredibly grateful. There will be a link to this in the chat. There will also be a link provided to CLAPA support services where you can access peer or parent support, the CLAPA counseling service, and our Cleft++ mentoring service. If you have been affected by anything discussed this evening, please do reach out for support through your GP, your local NHS Cleft team, or email us at info@clapa.com.
So some very important thank yous. Firstly, thank you so much to Andrew, Karen, Nick and Ambika for giving up your time this evening to answer all of our questions. It's hugely appreciated, and I'm sure everybody watching feels the same way. Thank you as well to everyone who has joined us online. This video will be available on CLAPA's Facebook page straight away, and a subtitled version will be posted on the CLAPA YouTube page as soon as possible. And of course, a very big thank you to Despina for taking your time to volunteer as a host this evening.
And a big thank you to you, Kate, for also volunteering this evening. Lastly, we'd like to say a big thank you to our funders, the National Lottery Community Fund and Smile Train. What an interesting evening this has been. If we didn't get around to answering your questions in the chat, remember you can get in touch anytime at info@clapa.com, where CLAPA staff can help point you in the right direction. We hope that you have enjoyed the Q&A and that we will see you again at one of our upcoming online events in the future. From all of us, have a good night and have a lovely rest of the week.